Morning.
Good morning.
How's everybody doing?
Woo!
This is the best weather day we've had in quite some time, I think. This is amazing. Welcome to 1 Million Cups. I see some new faces, so I'll go ahead and go through the spiel. 1 Million Cups is a Kauffman Foundation initiative. Kauffman Foundation is kind of everything entrepreneurship. And their goal or their mission is that if we share 1 million cups of coffee, not all with one person, but 1 million cups of coffee to talk about entrepreneurship in our local economy or local communities, that we can grow our local economy through entrepreneurship. So this morning, another healthcare company. So obviously I'm obsessed with them. Phyzit TCM. I met these guys about a year ago. We did a little interview I did an interview with their CEO for HARK, a HARK off-script series. And it was really good. They've made a ton of great progress since then. Had some great partnerships that are working out really well for them. We've got Stuart Welly in the back, and then Keith Moore is about to present, and they're going to talk to you about transitional care management and their brilliant tool to make it easier for patients and physicians. So Keith, take it away.
Thank you. Good morning. So I'm with Phyzit, and let me tell you a little bit about our company. We have 8 employees. Myself as the CEO, I have 2 founders of me, Dr. Stephen Cannon and his father, Michael Cannon. He's a lawyer. Mike Blanchett is our president as well, so I guess I have 3 bosses. But we're a local technology company focused on a very small area of healthcare called transitional care management. We have been around for about 2.5 years here, and you know, it's been more of a challenge than we thought, and it takes longer to do everything than we think as a startup company. We thought it would grow quickly, but it's a learning process. So to tell you a little bit about TCM specifically, that is this 30-day window after discharge from an acute setting. So that would be a hospital, acute rehab, nursing home, SNF, those sort of things. So what is TCM and why does it matter? Well, if you know much about healthcare, you know that there has been an evolving focus on different areas where expense is the highest or where outcomes need to be improved. We have a unique payer system where the people consuming healthcare are not always the ones paying for it. So sometimes we consume and expect the highest level of technology and care without as much regard for whether we can afford it. And thankfully, we're in a system where it's not always required that we can pay for it to be able to receive this quality care. But because of that, the payers are always focused on where they can save unnecessary expense and where they can drive better outcomes. So CMS realized that they were paying over $24 billion for what they thought are unnecessary readmissions in healthcare. There's been a lot of different focuses over time. I would say more recently, before the current focus, they were focused on length of stay for hospitals. It felt like hospitals were keeping patients too long, and that was driving up cost. So hospitals got better at that and drove length of stays down to 4 or 6 days on average. But because of that, when patients leave the hospital, and granted they don't need that level of acute care, but they're not necessarily completely healed. So that 30-day window, they recognized patients were bouncing back unnecessarily, that they needed a little more intervention during that 30 days to prevent it. There's a lot of data that shows if the primary care provider or another provider that has given them care will stay in contact and do a few things, that they can drive down those unnecessary readmissions. So transitional care management is focused on that. And we are just one small area of it, looking at that acute discharge 30-day window. There's more areas than that look at every transition from one setting to another to make sure that it's more graceful and successful. So CMS generated 2 new CPT codes beginning of January 13. And they were geared towards providers to offer extra reimbursement if they would do certain activities and meet certain deadlines within those first 30 days after discharge. The problem is the workflows that would have to be created were not like the normal workflow. There were some challenges with that. So it really wasn't utilized much in 2013. We recognized late in that year that this was an opportunity and that we could help them through technology to do that better. The EMR vendors, electronic medical record vendors that most practices use, don't have a workflow for TCM yet. And so we've, tried to fill that niche. So with Phyzit TCM, we give them a software tool to manage that workflow. It enables patient tracking, secure messaging, daily reminders to make sure they know what they need to do and when, and they're not missing opportunities, and then helps tee up the billing process. This is a shot of our dashboard to kind of give you an idea of what this looks like when they log in. And so they have got a line in this Gantt-style chart for every patient that's currently being tracked to know where they are and what stage and what needs to be done, as well as push notification to do that. It's just a shot of some of the secure messaging, what it looks like. This is a pitch deck that we use for investment, so some of this is not really geared towards what we do, but showing some of the reporting that they get. Let me skip through some of this, okay? Okay, so this is kind of a timeline about Phyzit. Again, we started late in 2013. I was brought on that fall to kind of help get this organized. And honestly, our focus was not TCM to begin with. It was creating secure messaging and telemedicine tools for providers and their patients. Our founder, Dr. Stephen Cannon, he's a pediatric urologist here in town. He felt that there had to be a better way. He saw his colleagues using text messages and emails inappropriately to communicate with their patients. And so that's where we started out. The problem was you couldn't monetize that, and you couldn't get traction at the time with those types of tools alone. So we recognized the opportunity that still met goals that we had in improving patient outcomes with transitional care, and we pivoted to that early in 2014. We've hired different people along the way, like Stuart Whaley here, and LJ, a developer. Stuart is an attorney and a software developer. He's worked in the industry for a long time and really has a good understanding of how those things come together to keep us out of trouble too, legally. Make sure that everything is secure and compliant. We launched early in January of 15, the 9th. We had developed our product through 14. We had done our beta testing with a clinic in Ash Flat that fall, and then felt like we were ready by the beginning of January 15 to launch. So we began adding clinics. By the middle of that year, we had 20 facilities that were using it, and I can't remember how many patients had gone through, but a couple of thousand. Later last year, we also got accepted into Athena's MDP program. Do y'all know what Athena is? Okay, Athena is an EMR, and they probably have 6 to 7% market share. But most people in healthcare that are using EMRs have heard of them. They have a different approach. They really are more kind of like an app store in that they have a core product, but they have more disruption please, or MDP, marketplace, where they will let companies like Phyzit that focus on more niche areas and that they don't have to chase those things. They can let us sort out the best solutions, and then they make it very easy to integrate with their solutions so that they can add these workflows to their EMR. So they let us join their MDP accelerator program last fall. And we've been through about an 8-month vetting process, and actually we just made what they call GA status, generally available status, a few weeks ago. So at that point, they feel like it's been tested. They've gotten feedback from people that used it in trial, their customers, and are now helping to promote us to the rest of their customers where they feel like it's a good fit. So we're excited about that. We also, last year, added Arkansas Health Group Practice Plus. It's part of the Baptist Health System. Very pleased to get them on board, and we are now in 21 of their clinics around the state. And then most recently, we have been working with CareSync, which is a CCM vendor, to integrate with their product as well. I'll tell you more about how we fit into CCM, which is chronic care management as well. And now we're up to 41 clinics, a little over 200 providers, and we've seen more than 6,000 patients go through the process as of this week. So one of the things that when we go out to clinic, we like to show them as a pro forma to give you some idea of how this helps the clinics and the providers. There's three parts to this really. The providers can make more money. The patients have better outcomes because of this interaction with their provider. And the payers, CMS and other insurance companies, they save expense, downstream expense from those avoided readmissions. So it's one of the rare things in healthcare where everybody wins. So to give you some example here with cardiology practices, we would extend the number of providers they had, the number of discharges they typically have per month, and show them the revenues that they would make. And for them, it can be a good increase. So it's something that they typically, once they're made aware of it, they're very interested. And we're thankful for that because, again, it ultimately helps the patients. So TCM and CCM, to tell you about how we fit in with that, we really fit in what we call population health. It's a larger area. So if you think of Office suite of products, we're kind of like the Excel. We're one component that we think fits into this bigger puzzle. And we didn't recognize that at first. We thought TCM was a strong enough focus area on its own, but it really is part of population health. So chronic care management has to deal with patients that have chronic issues they're dealing with month to month. And similarly, there's reimbursement based on intervention with those chronic patients to take more of a preventative or proactive instead of reactive approach to their health care. We are just the 30-day window after discharge if they happen to be admitted to an acute setting. And there's other components like annual wellness visits and care plan oversight that also fit into that. So as you can see, there's a lot of good players in each of these markets, but we really feel like we don't have another software as a solution competitor to ourselves. The closest thing that we have to a competitor would be companies that use a resource model where they have nurses and care coordinators, staff that are doing the work for the clinics. We provide software as a tool so the clinics can do it themselves more effectively. So the way we kind of define our progress here, phase one for us was just trying to continue past our beta testing to get proof of concept, to get to 20 clinics, make sure that people were using it, they loved it, continued paying for it, that showed that there was value to them. And so we've certainly completed that. Phase two is kind of where we are now, where we're continuing to look for channel partnerships, like with CCM vendors and EMR vendors and health systems to get ourselves out there more quickly. Direct sales is a challenge in healthcare. And get to what we call a $1 million run rate so that we can have another round of investment to help get distribution across the country. So this is just a slide showing the Athena Health marketplace and that we are now in there to give you some idea of that. What's that? And we're the only TCM vendor, that's true. Okay. That's really all my presentation for here. I just want to kind of give you an idea of what Phyzit TCM is about, a local company, and I'd love to entertain questions that you may have.
Yeah, let's give him a round of applause. I want to start it off with one question. You mentioned in that second window, phase two, there's some integration that needs to happen. Can you talk about, what are the barriers for you guys? Do you have to fully integrate or plug into their API, whether it's Epic, Cerner, Athena, or are you guys a little bit removed enough to where it's a little bit easier integration with those things?
Good question. I feel like it's not that challenging for us. So we have a workflow that doesn't exist in the EMRs, and that could change at some point. But what we've strove to do is make sure that it's easier for us to integrate with them than for them to create that themselves. With Athena in particular, they offer APIs that we can get the data out of their system that we need. So we need some patient demographic information to be able to track them independent of the EMR. And at the end of that process, we need to be able to push data back into their system. And so they have the APIs that make that easy for us. With other EMR vendors, it's been more of a challenge, but
Allscripts has a similar model, and so that's a really good place for integration. It's an Allscripts kind of app store scenario. A lot of the other vendors, like say Epic, they provide external APIs or HL7, messaging, but that's a more difficult integration. But Allscripts and I think are easier.
In regard to other vendors in the market, like CCM vendors that we want to integrate with, we feel like, again, we want to make it easy for them to add our workflow to their workflow. So we've developed APIs ourselves to make it easy to sort of plug that in, white label our product into theirs.
Well, and also the CCM vendors that we're dealing with are much larger, they're well funded, and have integration with most of these EMRs already. So if we can interact with the CCM product, let it bring the demographic information in and handle the interaction with the EMR, we really effectively don't have to do any integration with the EMR in those settings at all. So that's a win-win for us.
Okay. Well, I'm waiting on another question. So one of the things like workflow, like the touch point at which you guys come in and interact with that person and kind of in the healthcare chain. I've been working with a few companies, technology companies in healthcare, and that seems to be one of the biggest issues. It's like they build this great solution, but then it would work for people if it fit into the workflow the way they wanted it to, but the hospitals already have that workflow. Can you talk about the process where y'all found, okay, this is the workflow, this is the touch point in the current workflow that we're gonna have to fit in, and kind of how difficult it was or how easy it was maybe to figure out exactly where you fit in to the hospital's workflow so it'd be a low trauma adoption?
We had a good start to that through our beta testing with the clinic in Ash Flat. Dr. Brad Bibb he's also has a vested interest in our company, and very smart man. He helped us sort of figure out the best starting point, but it has been an evolution. I mean, with every implementation, we like to think we're very agile. We have good development resources, and we can make changes quickly. And we've made a lot of changes to the workflow to better fit the growing number of scenarios that we run into. Because you're right, they do have sometimes they're already doing TCM, sometimes they're not. But where they are, we recognize we need to more quickly replace the process they have by making it familiar to the process they've already created.
Tim Freeman, do you have a projected ETA on when you'll hit that 1 million run rate and move on to phase 3?
Our goal is by the end of the year.
What's the average number of contacts, Andy Foltz, average number of contacts that their follow-up is needing? How often is it the doctor, is it the nurse, somebody's responsible for those tasks to follow up? And is it phone calls and emails, or is it mostly electronic?
Well, as I mentioned, we started out with a secure messaging and telemedicine tool. And so the product that we created, we baked those abilities into it. The requirement specifically is an initial contact within 2 business days with the patient. And so for that secure messaging, we felt like it's a good way to get higher throughput than making phone calls. Honestly, most of them still make the phone calls. They don't have to get the customer to sign up for their side of the tool to communicate. And that's the pattern that they're more comfortable with. It's not as efficient, and we hope to change that over time. The capabilities are in the product. Same thing with the telemedicine piece. Another requirement is a face-to-face visit by calendar day 7 or 14, depending on the complexity of the patient, how sick they are. And with that, telemedicine is allowed by CMS to replace the in-person visit. There are some challenges in our state and in most states with where that can be conducted. There's something called an originating site, and the patient's home is not an originating site in Arkansas. I think there's 5 states where it is allowed. So as legislation changes that will become an easier replacement to use that technology. But for right now, they're making phone calls. They're still bringing them into the office. It still works.
Hey, Mike, Stevie with Sparkville. Thank you so much for coming, and congratulations on getting where you are today.
Thank you.
One thing that you said is something really good for a lot of entrepreneurs to hear and what they experience, and that is when you made the realization that you weren't the total solution, you were going to be part of something effectively larger. Can you talk just a little bit about how you made that determination and then what that did to change your strategy?
Sure, absolutely. For us, we knew we had a strong solution for TCM specifically. And as I mentioned when I started, sales is always a challenge. I think especially so in healthcare, because with a provider practice, they've got some pretty high walls up. They feel like they're doing everything the right way already, and a lot of times they'll deflect interest. A lot of money has gone into pharmaceutical sales rep process and these sales processes, so that's a big barrier for us. That was one thing that kind of slowed our pace a little bit. We also recognized that chronic care management, or CCM product, was a valuable tool, and there's honestly a lot more revenue to be made by the provider to do CCM. With our events, they're replacing a $70 or $90 office visit charge with $160 to $235 charge for TCM. So it's an incremental increase that adds up. For chronic care management, they're getting $42 and change a month to manage these patients. That adds up a lot faster. They have to spend 20 minutes a month interacting with them. So we felt like there was a lot more attention with our sales pitches. We recognized that we would tell them about TCM. They would always ask, well, what about CCM? You'll have a CCM product. So we determined that we were going to develop a CCM product pretty quickly. And when we got into it and researched the market, we recognized there were a lot of well-funded players with very sophisticated products already out there. And it was a saturated market that we felt like might be better to partner with them than to try to catch up and compete with them. It also, exposed us to the bigger picture of population health. I would say over the last year and a half, people's recognition of that has changed, and we just realized that we fit into a bigger picture tool that needed to happen. And I think that with the conversations we've had, people are always asking, okay, that's great, but what about all of this? So it became pretty obvious to us we needed to be a part of a bigger wheel.
My name is Jason Brown, and I'm interested in the marketing strategy that you guys have employed, if any, at this point. Are you trying to touch the doctors outside of the doctor's office? Maybe hit them in a social channel or something like that first. That way, there's name recognition when you walk in the door, or are you using influencers within the doctor's office first to sometimes nurses or folks like that make the decision? Yes,
both, all the above. We've tried many different things, and no strategy we found is always a solid approach at every clinic. The culture of the clinics are different. Sometimes the physician is very, top-down controlling type, and they're the only decision maker. Sometimes they let the people that are doing the work, the work that involves us, sort of drive change up, which is great. So, no one approach works in all cases. We found value in all those. So, for example, we approached the physicians first, and we had to do a lot of face-to-face time with them, traveling to clinics, getting their attention, showing them that we were a solid, trustworthy company, and not some fly-by-night company. And that worked to a degree. Conversations with coders that work in the office that actually do the billing side of this, we began to recognize that got us in the door in some cases. So we started doing some advertising through AAPC, which is American Association of Professional Coders. And that's actually gotten us more traction, I think, than directly to the physicians. Social settings, it always is good to have those conversations. I think that there's a lot of clinics that we have that really may have taken 8 months, 6 or 8 months to get them. And it was through multiple conversations in social settings, connections through peers, for them to really start paying attention to us. Personally, I believe there's a tipping point in healthcare in particular where with providers, they're very skeptical at first. There's some thought leaders out there that are willing to try things, but they get to this point where nobody wants to be left behind, and they really follow what their peers do because they're all talking to each other about it. They follow what their peers do more out of fear of being kind of left behind than otherwise. We're not there yet, but anxious to get to that point.
Hi, John Comnatz. Did you have any plans to gather analytics across your customers, and have you had any insights about either best practices that you're trying to introduce to clients that might not be doing the best job they can?
We do. I think we've gotten more confidence over having a larger number of clinics to be able to do that. We've seen more variations of it. So some best practices have become, more obvious to us, and we do communicate that out. We collaborate with people at CMS and other areas too to make sure that they agree with what we promote. Yeah, absolutely. We do collect data. We do watch the way that they use the app. We're of course looking for, validation and the reduction of readmission rates and things like that. So we're beginning to develop baselines now with customers when we go in, so that we have something for comparison. We didn't do that to begin with. Feedback surveys, those sort of things, to see more anecdotally as well, how they feel about the app.
But there's definitely room for some more sophisticated analytics, like a really nice analytics engine. We certainly something we can use. We're kind of releasing so many fires.
David Schindler, who is your competition and how do you separate yourself from them?
Okay. Like I mentioned before, our competition, we don't feel like we have a lot of direct competition. But if you go in and speak to investors and say that, you look pretty foolish to think that you have no competition. We just don't have another SaaS vendor that competes with us directly that we've found yet. Our closest competition is companies that offer TCM and maybe other services like CCM from a resource model, where they actually hire the staff. It's a lot more overhead. It's not something we've really considered tackling. But they go and they do more of the work for the provider. They keep more of the revenue that the provider would normally keep. And that solution fits some clinics better. Some doctors are more interested in that than having a tool like ours that they have to do it themselves.
So what is the revenue potential for TCM for the average provider? Is that something that you address with them in your sales presentation?
Yeah, it varies a lot, but on average, it's probably $1,400 to $2,000 a month in increased revenue for primary care providers. If they're a specialist, they tend to have a higher throughput. They're also a little better connected with recognizing when the patients are in an acute setting and discharged, and so they can run higher volumes through, so like a cardiology practice or something like that. But the most challenge is probably primary care docs. They're more and more so, hospitalists are doing the admitting, discharging. The primary care docs are not the ones that are putting them in the hospital and aware that they're even in the hospital. Healthcare is still pretty disjointed in that. We need to get better connectivity with when that happens. But normally about $1,400 to $2,000 a month increase. Some areas, if they're like, up by a retirement community, they're going to have higher number of hospitalized patients than in other younger populations. Yeah, there's also other programs like CPCI and PCMH that are driving towards some of the same goals, and our tool helps them kind of get to those outcomes as well.
So this was kind of it was from 2010, but in 2010, I think it was 40% of physicians were 55 years old or older. So with kind of that, we talk about baby boomers in the sense we're caring for them. There's a lot of baby boomers at our hospitals. Have you seen any kind of lag or any kind of that older generation of doctors not wanting to adopt technology to use these types of things? And then kind of on the flip side, have you seen the younger doctors be much more embracing of this kind of technology?
Yeah, unfortunately, yes. There's still a clear pattern there of adoption of technology. The beauty of our solution is the doctors really don't have to do anything with it. If they're not using the telemedicine piece, interact directly, for them, it's just another visit scheduled in their office. It's usually their nurse, their care coordinators, their billing people, office people that have a role in our product and have some function within it. So part of our pitch is that they really don't have to do anything different other than make sure they're blocking time, if necessary, to schedule hospital follow-up visits, because sometimes their schedule is so full that they have to kind of create that time or bring on a physician extender to help them deal with an increased volume. But yeah, there's a clear pattern in age. I would say we went to a conference recently, Arkansas Medical Association, where more of the older demographic come to those. They sit on committees and positions like that, and I recognize that they're just not as interested.
Is there any other questions before we? So this is the period where we let you ask the crowd anything you want. Ask for, like our Facebook page, talk to us about this, reach out to us for XYZ. Floor is yours. Ask anything you want of the audience.
I hadn't expected that. Well, I would just welcome you to reach out to us and learn more about what we do. We're just down in the River Market above the Channel 7 news station and Willie D's and the Psychic. She's pretty quiet though. Willie D's will get cranked up in the afternoon. We're not far away. By all means, please learn more about us. I'm sure there's lots of things I could have told you and didn't think to today, but appreciate the time to tell you a little bit more about us.
Absolutely. Excellent job. Round of applause, guys. So before we wrap up, Mike has a little announcement real quick.
Yeah, and by the way, anybody in the audience who ever has anything like this, I mean, please, step up. But I just have a company that's approached me, and it's in the manufacturing sector, but they're looking for kind of an analytics position. It's a marketing and analytics side to leverage some technology and do some interesting things to help them grow. So if you know of anybody kind of mid-tier, not entry level, but just step above that'd be interested in that, just give me a shout.
Okay, awesome. Thank you, guys. And thank you for coming out. Please follow up if you need anything. These guys will be hanging around for a little bit. Grab them, grab their cards. If you know any physicians or nurses that work in a setting where this could be applicable, please tell them about it. Talk about it. Tell them to reach out. But thank you guys for coming. We still do have hot coffee, so feel free to hang out and enjoy the 1 million cups. Thank you, guys.